We've been waiting for this a long time. The promise that we've made to our community is finally a reality. We recognized over 10 years ago that the emergency services that we were offering were not competitive and were not contemporary. So that became a very important priority for our strategic plan.
It's a large undertaking of the hospital, but it was something that was needed for the community.
We're excited. The community's going to benefit from this so much. It's just fantastic. Tremendous difference as to before and after, whether it's capacity in our waiting rooms, which if you look at our current emergency department compared to what we're sitting in right now, the capacity is tremendous.
The facility was designed to take care of this community at peak times, when there's an overflow of surge and a large amount of patients coming into the emergency department. It's been a bottleneck, it's been a struggle to get everybody through the department as quickly as we want to and give them the standard of care they need at the same time. With our 30-room expansion, that challenge should disappear.
It's going to enhance so much, not only for our staff, the physicians, but the patients. Prior to this, our patients had to go down a public hallway to get their imaging. So now to have everything contained within the ED suite, it just will enhance that patient privacy, enable us to work better as a team.
The specialty rooms that we're going to have in our emergency department, specific to trauma, specific to women's health, specific to pediatric care, as well as the additional exam rooms that will really cater to all the individuals that need our services. Surgical services wise, larger ORs, greater technology, greater efficiency and throughput, logistically for our staff as well as our patients. It's day and night compared to our existing facilities to what we have now, state of the art.
We can have everything at our fingertips. In the prior ORs, we had to pull carts in, pull carts out, pull this in, pull that out. We had what we needed to do to take care of the patients, but now it's all at our fingertips. It's right there. It's just pull it right into the bedside, it's ready for it to go. All the equipment is right there. This is going to help with flow, it's going to help with turnover time, it's going to speed up the process of how we can get the patient through and back to their loved ones sooner.
Well, we have a tracking board now, so when our patients' families are waiting in the waiting room, they'll be able to look at that. They'll have a code, so only they will know who their patient is on the board, and they can follow them through our whole surgical services, know exactly where they're at.
Building Together campaign was the capital campaign that the foundation took the initiative to help raise funding for the $22 million expansion of the new emergency and surgical department.
It goes from dream to reality through a lot of teamwork, a lot of involvement by not only our staff members, but the leadership of our board and the involvement of our community.
That's where we step in. We stepped in to pass that on to the community, as well as I said, bring it back to the hospital so they understand what is needed.
We have spoken to individuals who have and are currently using our facilities, and they've made some great suggestions. We put all those needs together and funneled them and discussed them, talked to our staff, and we designed this project based on the needs of the community.
Well, we've always had the quality outcomes, the great quality care. Now we have the facility to match it.
It's a quote from our medical staff president, Dr. Bob McGann, and he said, "They built us a new stadium." And actually the ones that have been here know what we've gone through in the last 10 years trying to get this off the ground, and they actually believe this is the dream, and we're handing the dream over, not just to the community, but to our physicians as well.
Well, it takes you back to your roots. When you went into healthcare to be a nurse, a pharmacist, whatever, you went because you want to give care to patients, and trying to get the staff to the bedside where the patient needs them the most is always the ultimate goal. And with fine-tuning all the processes and making them streamlined, that will get the nurses and doctors to the patient.
Being able to do it more efficiently affords us that time to spend quality time with our patients, which cannot be replaced. And that's what the patient remembers. We've always given quality care. We want to spend that quality time, that personal relationship that we develop, and this will afford us to be able to do that, and that's what we're excited about.
I'm most proud of the teamwork and obviously the end result of this fantastic facility. What we're going to be able to offer to the community, those folks that need health care, they're going to be able to receive it in a first-class, high technology, great staff environment, and that's, I think, what I'm most proud of.
Healthcare is local, and at some point in everyone's life, they will need healthcare, and they want it to be of a high quality, they want it to be safe, and they want it to be in contemporary facilities that they can be proud of. And we're offering that pride and that involvement to our community with this project.